Hello everyone, I'm Anastasia signing in from Nora's. In today's session, we are going to deal with a very small yet an important topic known as confidentiality. Confidentiality means respecting one's privacy as well as abstaining from sharing any personal or potentially sensitive information about an individual. However, when we talk about we nurses, in nursing, confidentiality is the right of an individual that his or her personal as well as medical information must be kept private and confidential. Such a delicate and confidential information about the patient must only be kept between the patient and the doctors, the patient and the nurses, as well as between the healthcare professionals who will be responsible in providing care for that particular patient, and also the health insurance company. And as we know that nurses are responsible for providing care to the patient, so it is important that we get a detailed idea of the condition of the patient, of the personal information of the patient as well. But here we must keep in mind that we nurses are legally as well as ethically obligated to keep any information about the patient confidential. We must never discuss the patient diagnosis, treatment, medical history, personal history, or any other information related to the patient with the other patients or even with the other staff members who are not involved in the team which is responsible for providing care to the patient. And it is also our responsibility to make sure that only the staffs who are directly involved in providing care to that particular patient must have a legitimate access to their record. And in order to enhance the confidentiality of the patient, there are certain institutions which have also made a certain policy to control the sharing of information. So here there are certain institutions in which the patient must provide a written information for the release of their medical information. So here, in order to provide as well as to enhance the privacy and the confidentiality of the patient information, certain institutions have made a policy whereby this sharing of information will be limited. And here, in certain situations, these patients may also have to provide a written permission in order to release their medical information. There is also a legislation to protect the patient's privacy for health information known as HIPAA, which stands for Health Insurance Portability and Accountability Act, which would govern all the areas of the health information of the patient as well as management of the information. As in, this act will manage as to how and to which extent this for information about the patient is to be communicated. As in to whom and how this information, as well as to what extent can this information be communicated the patient to the healthcare providers. And in order to eliminate the barriers that could delay the access to care, here it is the responsibility of the healthcare provider to notify the patient related to the privacy policy, and also it is their responsibility to make a reasonable effort to obtain a written acknowledgement of this notification, because here some patients may later on say that they did not know about the privacy policy, or they may create a ruckus because of it. So in order to prevent this from happening, it is the responsibility of the healthcare provider to notify the patient about the privacy policy, as well as to obtain an acknowledgement related to this notification. HIPAA also requires that disclosure or request regarding the health information of the patient are limited to a minimum necessary. That is, it must include only the specific information which would be required for a particular purpose. So by doing this, it would help to prevent the miscommunication, as well as the passage of information from one person to the other, or even to the other healthcare professionals which are not relevant to their disease condition, or even to the purpose for what this is to be communicated. And we also see that sometimes we nurses may be using the record of the patient for continuing education in order to collect the data, in order to conduct a research. So here, as long as the permission is granted, then we can use the data of the patient. But if we have not obtained the information, then we must never gather the data, or we must never conduct any research without the granting. Sometimes we also see that nurses uses these records for their continuing education in order to gather the data, in order to conduct research. So here, as long as permission is granted, then they can use the records or the files of the patient. But if the permission is not granted, then no research or no data collection must be allowed from the record of the patient. And as we know that a hospital is also a place where student nurses will be present in order to practice their theory. So here the students can review the record of the patient in order to enhance their knowledge, and in order to get a clear idea of the disease condition, as well as to put their theory into practice. However, we nurses must make sure that they must review only the information that would help provide a safe and effective patient care. And as we have also seen that with the advancement of technologies, many institutions has also started saving the record of the patient with the use of the electronics. So here, even though we are saving the records of the patient, this will not be easily seen by any other healthcare professionals until they have the user ID. So as nurses, we must make sure that this user ID must only be shared with those healthcare professionals who are involved in providing care to that patient. because if any other staffs view this record, not only it is unethical, but breaches of confidentiality can also lead to disciplinary action by the employee, as well as dismissal of the employee from that institution can also be done. Because here, as we have understood, why is it important to maintain the confidentiality of the patient, and as we have also know that each and every patient has their right to keep their information private. So if this is being done, if there is sharing of information, or if any other staffs view the patient's record without permission, or just because of curiosity, then this is not only unethical, but this is also breaches of confidentiality that can lead to a disciplinary action for that particular person. In order to also protect the patient confidentiality, we as nurses must also ensure that any written or electronic material used in the student clinical practice must not include the patient identification, because here if the patient identification is included, then they will get a clear idea of all the personal information, of the medical information of the patient. So in order to prevent the passage of information, what we can do is, when we provide these data to the students or to the other healthcare professionals for various reasons, we must make sure that the patient identification must be excluded. Not only that, but we must also never print materials from electronic health records for our own personal use, because again, if we do this, this will lead to breach of confidentiality, and again, this is unethical. So here we must make sure that we prevent the spread of the information about the particular patient, and we must also make sure that we maintain the privacy and the confidentiality of the patient's record. So these are the various points that we nurses must keep in mind in order to maintain the confidentiality of the patient. So I hope by now you have got a clear understanding of why is it important to maintain the confidentiality of the patient, and what are the various things that we must keep in mind in order to protect the privacy as well as the confidentiality of the patient's information. So I hope you have got a clear insight of this topic. I'll be meeting you in the next session. Until then, have a good day. Thank you.